for your child. If you have any questions, please type them in the question section in your Zoom control panel, and I'll bring them up during the presentation. We will also hopefully have time for some Q&A towards the end. Okay, so without further ado, I'll pass the time over to Victoria.
Hi, Dr.
Lisa.
Hi.
Okay, can you bring up my presentation, please?
Yep, sure.
So, my apology if someone cannot understand my English because it's not very good, but we have one translator here, which is she will type what I say in the column chat, the chat column.
Susah makan. Milih-milih sekarang udah mulai ya, mulai susah ya, tapi bukan.
So today we're gonna talk about the cause of fussy eating. I want to point out that when a child doesn't eat well enough, it is not in their head, but it's all in their body. So there are no single child who wants to be a fussy eater, because as humans, it is our nature to preserve and to keep growing. So for you, like maybe you think they are intentionally wants to make your life difficult. No, it's not like that. They have something, some problems in their body, but they cannot communicate it with you guys, with the parents. That's why we have to find out what happened with the child. So no one, not one child wants to be a fussy eater. And 90% of the time, parents are not the major source of feeding issues. So some parents I found that they feel very guilty because they think they cannot feed the child. It's it's the parent's problem. It's not the child's problem. But 90% of the time, parents want the child to eat, and they are not the source of the problem. So this is like the iceberg theory. The feeding problems is what we can see. Can you share with us what's your feeding problems that you have experienced or know of? You can type it in the chat, like my child can only this, or I can see my nephew or my cousin like this. Can you share with us?
Share apa?
Type your answers or questions in the chat, and we'll take about a couple of minutes just to think of the feeding problems that you might have experienced.
You can type it in Indonesia. That has to be in English because we can understand in Indonesia as well.
Cuma sayur sih. Eating vegetable ya. Vegetable ya. Yeah. Yeah.
My child only eats meat if it's together with rice. And so he or she cannot eat it by rice alone. And it's only a very small amount of protein. And she only prefers rice.
Okay.
So I understand this question as it has to be eaten together. It cannot be separated, right? Okay, any thoughts on that, Victoria?
So the most problematic food groups for children are vegetables and meat, because those two are stringy. They have fiber, so it's hard to chew. When a child has sensory problem or immature or weak chewing ability, these two groups will be eliminated from the diet by the child. not because they don't want to eat it, but they don't have the ability to cope with it. So the ones that they would like to eat is usually rice because we are Southeast Asian, because it's very soft and it doesn't give us too much sensory input. For some children, too much sensory is problematic as well. So we're gonna talk about it later as we go on. You can continue, Doctor.
Time for one more question. So, Lucia says, my kids has good. They easy to eat. They eat well, and you have made various food groups. That's great. We'll also be talking about how to increase the variety of food through food chaining. So I think that's something which Victoria will pick up soon. Maria says, my child only eats a little bit, and is quite picky. Victoria, would you like to share maybe just one strategy, and then we can move on?
So the most standard strategy is to give variety and keep offering food because our child may not be accepting food with one experience with the food. Like they only see it once and they will readily accept it. It's not the case. Usually after 15 or 20 times we offer it, then they will willingly to touch it or bite it. So it's not one off. If they don't know how to try it in the first try, keep trying.
Have to introduce the food as many as 15 to 20 or even 30 times. And sometimes it's okay to put the food in front of them just to let them see it. There's no pressure for them to put it in their mouths. Just see it, touch it, smell it, and then we slowly try to create a positive environment, but no pressure on the child. So Victoria will be most happy to share it as we go along.
So what we cannot see besides the feeding problem is the problem is the organ system. So when we are eating, we are using all our organ systems. If you think how can we use our respiratory system when we are eating, so when we are eating, we have to share our trachea here, our neck area, with the respiratory system. We have to stop breathing to be able to swallow food. So when we have troubles with the respiratory systems like tuberculosis or asthma or like corona or COVID, something like that, it will be hard for the child to eat because they will try to breathe and they cannot swallow willingly. It's very hard to be able to manage it together. And all muscles. So when we are eating, we are not only using our mouth muscle here in the face and the neck area, but we also using our body's muscle. So we have to sit upright, and with that, in sitting upright, we have to use our back muscle, our stomach muscle, and our foot muscle to keep our posture upright and stable for a period of time, like 30 minutes, giving a window period. All eight sensory systems. So when we are in school, we are learning about five sensory systems: eye, smell, touch, but we have more than that actually. Now there are eight sensory systems. We have vestibular, it is in our ear to manage balance. So when we are neural system going on, and then we have tactile. Tactile is the touching. So we are having our tactile sensory with our inside of our mouth and our tongue. And our proprioceptor is the how hard our jaw is moving with the food. So if it's meat or if it's vegetable, unfortunately, it's stringy, it has fiber, we have to move more and it makes the child feel tired. So that's why they feel reluctant to eat it. It will also depend on the nutritional status. So when someone is, let's say, malnutrition, malnourished, they don't have enough calories, stunting, wasting, it is hard for them to manage and to metabolize food that they are ingesting. So when we are malnourished, we don't have enough energy to start the metabolism process. That's why we have to give the child enough calories for their growth and their ability to keep metabolizing the food. The next is the child's learning ability. So some child learning ability is different. Some prefer audio, so not audio, visual. So they are learning by seeing. So they want to see pretty bento style food that has colors in them, variety of colors, or they want to touch it. So you will see that some babies prefer to have independent and touch their food by themselves. That's their learning ability. And then it also depends on the growth stage. So some premature babies will have different sensory and ability to accept food and to metabolize food with the full-term baby, let's say. That's one of the examples. Uh, Below 1 year old will be different with the above 1 year old in terms of accepting food and how they um, manage the food. And also the environment. The environment is how the eating, the food environment, the feeding process is going to be like how we present the food, how we talk about food at home, how we uh, try the children to try the food, like how we talk to them to able to try the food. That is the environment that we provide for them. So next we are going to have three questions, and I want you guys, to type in the answers in the chat column. The first question is: do you think eating is instinctive? So some parents I heard say that of course they have to eat because eating is such an instinctive move that they will die if they don't eat. So do you think eating is instinctive as well?
N for no. Thank you, Lena, for your answer. Okay, we will review the answer in a minute's time. So whether eating is instinctive or not. Okay, we've got lots of questions coming in, so I will hand the time to Victoria. Victoria.
So the answer is no. Eating is not instinctive for babies or children above 6 months old. It's only instinctive for the first 6 weeks, and then they have the reflex to find the nipple. But above 6 months old, it's a learned behavior. So they learn how to open their mouth when a nipple or a bottle or spoon comes, learn how to bring the food or the spoon into their mouth, learn how to accept or react to certain food from their parents. So no, it's not instinctive. They have to learn about it. Next question. Do you think eating is the most important thing to do in your life? Do you think eating is the most important thing to do in your life? Apakah makan merupakan hal terpenting dalam hidup Anda?
You think it's the most important thing in your life? Type Y for yes. And if you think that no, it is not the most important thing in a child's life, type N for no. Okay. Maybe we could give a clue, Victoria. Okay, Nadia says no. Lucia says yes.
Okay, so it's a mixed answer, and the answer is no. Eating is not the most important thing you do in your life. Breathing is. So you can go without eating for 3 days, 10 days sometimes, but you cannot go without breathing even for 3 minutes or 5 minutes for 20 minutes. So breathing is the most important thing you do, and the second thing is preventing your head to fall and to get hurt. So your posture stability. One breathing, the second is preventing your head to fall down. Breathing is the third important thing you do in your life. Next question. So, is our digestive system is the most important organ system in our body? Apakah sistem pencernaan kita yang terpenting di dalam tubuh kita?
Let's type Y for yes and N for no. Nadia says no. Vanessa says yes. Okay, so we've got more no's this time. Helen says no. Amanda says no.
Oh, smart mom. They are listening. They are listening. So, most of you guys answer correctly. So, our digestive system is not the most important organ.
Hi, I'm sorry. I think Victoria has lost connection for a while. Let's just give a few minutes and she'll come back online. So I'll just continue with sharing just a little bit about eating, especially for picky eaters while we're waiting for her to come online. Picky eating is pretty much a lot of a challenge that parents face, and it's not just you alone, but in our clinic and as well, I'm pretty sure in Indonesia, there are lots of children which may have various feeding difficulties. So some of them you may have experienced, they might be pocketing food. They might also be having difficulties with chewing, and those are some areas which we will touch on. So I see Victoria will be right back again. Victoria, welcome back.
Sorry, my
No
computer
worries.
died.
Okay, yes. Over to you, Victoria.
Okay, so suara siapa yang nggak kedengeran? Can you hear me? Good.
I can.
Okay.
Okay, great.
So our respiratory system is the most important thing because breathing is the most important thing we do. And the second thing is the cardiovascular system, because after the oxygens, we inhale the oxygen from the respiratory system. We need it to be circulated throughout our body with the cardiovascular system, throughout our blood, actually. So the first is the respiratory system, and second is the cardiovascular system. That's it. So your guys is listening, so I'm happy about it. Next. First, when we are finding the cause of the fussy eating, we have to rule out the medical conditions. So medical conditions range from the easiest thing like cold and flu, teething, or they have the the urinary tract infection, or it can be something bigger like GERD or reflux or colic, the food intolerance and food allergy and food sensitivity, the EOE. EOE is the inflammation of the neck, inside the neck, our esophagus. The dysphagia is the trouble of swallowing. So the muscle here is not connected, like it's not very, well, how can we say in English? It's not connected with our brain. So when we are swallowing, it usually goes into our trachea. So we go gagging, keselak. So we usually go keselak. The other thing is the autism, or not only autism, but developmental disorder. And also something like tuberculosis, something that happens with the lung, like I said before, the respiratory system, or asthma. So we have to rule out these conditions first before we can move into the next section, which will be talk about deeply. So that's why, yeah. Next, Miss. So after we ruled out the medical conditions, we can move on to the next skill sets from the therapist perspective, which is the first most important thing is the sensory tolerance. So it's not the process of eating itself, but the sensory tolerance. The second is postural stability, how we sit, the tongue tip lateralizations, the movement of the tongue, the rotary chewing, the movement of the jaw, and then the positive mindset. Next. Sensory tolerance. So I said before that there are 8 sensories that we need to look when we are eating. The taste, obviously, the tactile, how the have textures, is it rough, chewy, or fluffy, like some marshmallow is kind of fluffy, or is it stringy, or is it soft like pudding. The visual, the colors, the shapes, the audio. Every food has different audio input when we are eating them. So when we are eating, when we swallow and chew, we have some audio input here. So if next time when you're eating, please try to listen to your chewing from the first bite to the last bite before you chew, before you swallow. It will have different sound. Even your swallowing have different sound as well. So you'll try next. Okay, after this, you can try some biscuit or something. You'll try to hear the voice. And the smell, obviously, every food have different smells. Next is the vestibular. Like I said before, when we are eating, we have to be upright. So from the neck to our hip, it has to be upright. You'll notice if you're going sideways or if you're sleeping sideways, you'll have difficulties, even us as adults, will have difficulties to swallow because our body doesn't allow the swallowing action happens when we are sideways or it's not in upright position, to minimize the risk of gagging, the risk of keselak. Yeah, the risk of gagging or vomiting. The next are the proprioceptive. Oh yeah, it's choking. The risk of choking. The next is proprioceptive, which is how hard our jaw and our joints and muscle move. So when we are eating something hard, we have to really move our joints and jaw muscle. And sometimes children doesn't like to do that because they are focusing their energy to metabolizing the food inside the gut, which is take a lot of energy as well. The last one is the interoceptive. Interoceptive is the sensory that you have inside your body. So if you're feeling hungry, thirsty, sleepy, wants to poo, it's all called interoceptive. So how sensitive is the child with his or her hunger cue, thirst cue, and satiety cue? If you keep offering the child food every single time because you think they don't eat enough, so they have to be offered food like every hour, they will not learn how to accept the interoceptive input. So they will not learn how to be hungry and to be thirsty. That's why they don't eat too much, because they don't know the input sensor of their own body. Within the sensory tolerance, we have the normal ones, we have the hypersensitive ones, and the hyposensitive one. The hypersensitive one is the ones that have small sensory input, they react crazily. For example, when some children may act too much aggravated, like if we touch them like this, they say, "You push me." That's hypersensitive. The hyposensitive is when you already push them so hard, they don't feel it anything. They just stand there, or they bump into the walls or into the doors and they don't feel anything. That's the hyposensitive one. Some children in eating may eat spicy food that we think it is not suitable for kids, and they will say it's okay, I don't feel anything. That's hyposensitive. So hyper and hyposensitive of some sensory issues will bring issues when eating. Like we may perceive the child to be picky eating while they have the sensory issues here. Next. So now for the postural stability, this is the experiment time. I want you guys, you're sitting right now. I want you to sit with both of your feet not touching the ground. So lift up your both feet together. Not touching the ground. Both feet not touching the ground, and stay to sit upright and stable, like when you're eating. But your feet do not touch the ground. So what do you feel? What do you feel when you're eating or sitting without your foot or your feet touching the ground? Share your experience. How do you feel?
Stable.
Okay, a lot of people say tired. Yes, it's tiring, not comfortable. So you know that sitting without the feet touching the ground is not comfortable. It's tiring. Next, Miss. Not yet. Yeah. So now, do you know what's the trouble or the problem with these kinds of high chair, which is usually used in Indonesia actually? The white one is very loved in Indonesia. Every restaurant have it. You'll know the trouble or the problem if your child doesn't want to sit for eating with the high chair, they cry. They don't want to sit in their high chair at home. They don't want to sit longer, more than 5 or 10 minutes in the high chair. Or when they're eating in the high chair, they want to be spoon fed from someone. They don't want to self-feed. The problem is with the postural stability. So when you're sitting not supported, it's very hard to be able to focus on your food, especially because your stomach muscle, which you will need to use for the food metabolism, is used to guard your posture so you don't slip away. So instead of using it to eat, the children are using it to guard their posture, to be able to sit upright. And 5 to 10 minutes, it's kind of hard. They will lose their focus quickly to their food, and they will want to run away from the high chair. When you're looking for a high chair, these ones are the good ones. They have the foot support, so the feet has to be supported like this. Cannot be like this. Have to be all of the feet sole touching the ground. If possible, they have the arm support, which can be the table, and they have the back support, which supposedly up until at least until their lower neck here. But if it has until the head, is also good. So it's a 90 position, like that, like number 4. Okay, thank you, Miss. And the next one is the tongue tip lateralization and rotary chewing. So this is experiment time again. If you have biscuits or crackers or kerupuk, you can get. We will try these experiments together. So if you can grab a biscuit or a kerupuk now, and we can try this together.
Everyone grab a biscuit or cracker.
Everyone ready? Okay.
1 minute, Victoria? 1 more minute.
Huh?
Okay. To grab their biscuit.
Okay. I'll wait here. Quietly.
Okay, I think we can try the experiment.
Okay, so now I want you to try to bite the kerupuk or the biscuit or the crackers with your front teeth, but consciously, intentionally, you don't bring it to the back. You bite it and try to mash it or try to bite it with your front teeth only, but with your mouth closed, like this. without bringing it to the back of your molar. It only happens in the front of your mouth. And then try to swallow it without drinking. Without drinking. Now you notice how it feels. The next type of swallowing as chewing is you bite it with your front teeth, but you mash it with your tongue up above your mouth. So like when a child sucking the bottle. Try to mash it with your tongue to the sky palate, the palate of your mouth. So the ones moving is your tongue, not your teeth. Again, try to swallow it without drinking after you finish mashing it. All done? All good? You can drink now. So how do you feel about this experiment? How do you feel chewing with your front of the mouth? I only see one response. So anyone else wants to share the experience? Surprisingly difficult. Feels weird. So next time when you see your child pocketing the food like ngemut, or you think that they are chewing, you need to see if they're chewing with their like this, and you will know what they're feeling. You when especially when you're trying to push them to chew faster and swallow faster. So the next slide will show you guys how is the chewing, the chewing should be. It should be a video, but it's not. So it looks like when a cow chew their food. So everybody has seen a cow chew their food, right? A real life cow. So what moving is the jaw, like this. It's a bit too much, but it's like it's very visible. A cow is very visible. We don't chew like that. We chew not quite visible. That's why I use a cow as an example of chewing, the rotary chewing. The jaw movement is like that. Like, can you see that? While the tongue, the lateral movement is to push the food to the side. So the tongue is moving as well, like that. instead of up and down. Up and down is when the child is sucking a bottle or a nipple, but with food, it should be right and left. That's how it should be. So I think we are done with the slides for today because we should have time for questions in the last 15 minutes. So when you see the jaw movement like this, up and down only, it's like when you try the biscuit just now.
So just to add on, Victoria, I think for rotary chewing, it's also which Victoria mentioned, side to side, up and down, and also diagonal. So, diagonal, yeah. And in that way, it's rotary. That means all around. Yeah, we don't just chew up and down. We also move the jaw from side to side and sometimes diagonally as well. Okay, so thank you, Victoria. It's very informative. It looks like we have quite a number of questions. So just a reminder, if you have a question, just type it into the box in your control panel. So we'll start off with the first question. We've got a question here on how to spoon feed a child. So I'm assuming that it could be some difficulties with spoon refusal or the child's not actually closing the lips over the spoon, but rather maybe using their tongue to lap the food up. Any ideas or suggestions, Victoria, on how to spoon feed a child?
So with the spoon refusal, we have, I can suggest a few suggestions. One is the spoon desensitization. So you are regularly touching the child with the spoon until they are just like whatever with the spoon. And then you're moving it closer to the mouth area. So it's like the SOS procedure, but with the spoon. And you can use another thing beside the spoon for them to eat, like the BLW, baby led weaning, finger food, or you can use something else like a crackers to feed the child, just for them to open the mouth. You can also use the straw for the thick puree if you are using the puree, for them to able to suck the puree out of, not, or sippy cup. If they are unable to close the lip, I think this is more like Dr. Lisa's expertise, what kind of, but from my perspective, they need to train with the straw from my perspective. So they have to be able to close the mouth with the straw. So squeeze bottle with the straw is what will I use for them. And then chewing practice and the lip practice with the teeter with like this. Sorry, I'll grab my teeter first. So like this, like a teeter, like this. And we will try to bite it with the lip and hold. And hold. This is what will I do because I don't know anything else. This is from my perspective.
Victoria, yes, a lot of the times for spoon feeding, we have children who don't use their lips, so they use their teeth to strip the food off the spoon, like they use that rather than their lips. So it's a combination of cup drinking, getting them to use the oral motor skills to facilitate lip closure, jaw stability, which Victoria said was very important, as well as posture stability. Because a lot of the times when their core muscles are weak, their fine motor muscles will also compensate. Okay, thank you, Victoria. We've got another question. We've got a question from Sabita. She says that my child has been diagnosed with autism and has feeding difficulties. My child only wants to eat oatmeal, chicken nuggets, snacks, and some milk from certain brands. He often pockets or keeps the food in the cheeks, and sometimes he spits it out. Is there any strategies that you could recommend to facilitate or improve the eating?
So smelly and watery stools is basically or mainly I think is food intolerance. So you should get a test for the food intolerance or food sensitivity straight away. And then for the food, the limited food choices, the autistic people with ASD or autism usually have two types of sensitivity. One, the sensitivity of sensory input, so everything that happens with their body, mouth especially, and sensitivity in their gut. That's why with the food intolerances. So both things will lead him or her to the limited food preferences. Some food that they cannot, her cannot say what food is causing the tummy ache, the watery, the diarrhea. So they will self-limiting. So they will not happen again in their life. They're self-limiting because of the tummy ache, of the food intolerances, also because the sensory input is not to their preferences, too hard. The color's not right, the shape's not right. So you have to work with the professionals to be able to introduce new food and to manage the food intolerances.
One more question from Bella Den Win. My child is 3 years old, 3 years old, and he used to take vegetables and fruit, but now he rejects it. We're not sure why. It could be due to maybe a bad experience. We're not sure. But he likes to eat only dry foods now, doesn't like soupy foods. Any feeding tips that you can recommend to increase the food variety?
I'm guessing that he has experienced choking with the watery types. Maybe his swallowing is not mature enough and it's too fast. The flow is too fast. That's why they're choking. That's now they're self-limiting to make sure it will never happen again. So you can make sure with the water if he's drinking water, if they happens to choke regularly with water or not. And usually with the 3 months, the texture of the fruit may change or the shapes. When they are above 1.5 years old, we give them the soft ones, the bite size. But after 1.5, we expect them to be able to master the chewing and swallowing. So we give them the harder fruit, bigger shapes or something like that. So I'm not sure which one is going, the traumatic experience or the texture of the food is the problem.
Thank you, Victoria. So maybe we could have a look at the sensory preferences and texture and play around with the temperature, the taste, as well as maybe even how the shape of the food looks like.
Mhm.
Some children might have certain preferences. So I encourage you to maybe, if you have further questions, you can. Victoria also does online consultations. So we'll give you in the information on contact details in a minute. We've got a very interesting question from Vanessa. Vanessa says, my 13-month-old easily opens the mouth, so no problems with accepting the food, but he can spit the food out that he just swallowed. So he can either maybe regurgitate the food or purposely gag on the food that he doesn't like or he doesn't feel like eating. And that's quite a problem because mom says that it's most of the food and that's what's happening. Is this a sensory issue, number one? And number two, how can I prevent this gag and regurgitation, intentional regurgitation, I suppose?
Before we go to the sensory issues, I would like to check if he's having this dysphagia or difficulty swallowing with the barium swallow test, or if he's having the stridor, or the cleft palate, but it's in the muscle here. So something might be happening there that makes the child wants to uncomfortable to swallow something. If they have you already done test, then we can move into the sensory play. Maybe it's sensory because it's not the texture is not right for them. The volume of the food is too big for them to swallow, but they can manage smaller bites maybe. Sometimes that's the case.
Thank you, Victoria. And maybe perhaps if bite-sized food works for your child, you could cut it up into maybe cube size and have a toothpick. Maybe different colored toothpicks. It can be quite fun, or poke the food on satay sticks, just to give them a different variety and presentation of the food. Okay, we've got one more from Hard Tatik. Says my child is 11 months old and for a month has been spitting food, not interested with food at all, plays with the food. Is this a normal stage of their eating? Or is it time for him or her to play with the food but start to feed and swallow the food? 11 months old.
So they should be interested in food. It's either they don't have the ability to chew and swallow, or they are playing the power play with the mom and dad because they want the attention, especially the ones that have smaller babies coming in before they are 2 or 3 years old. So the attention is not enough on the child. So they are getting attention when they are being fussy. So they like it. They have attention. Even if when we are angry with them, it's attention for them, I think. So when they're splashing the food onto the ground, you get angry, or you pick it, get it up again. It's attention for them. So you should be ignoring the unpreferable attitudes.
Thank you, Victoria, on behavior management. Very interesting question. In Singapore, there are lots of parents who put their iPhone or their iPad in front of the child, especially in restaurants, because they feel that's the best way to keep the child quiet and sit in the high chair to finish their meals. In your opinion, I know this is not so much on sensory and feeding issues, but do you think that's something that as a parent you will encourage? Does it distract them, or they should be focusing on what they're eating? What are your thoughts?
Using a gadget for while feeding will increase the risk of fussy eating because they are not focused on what they are doing, the sensory input, whether they like it or they don't like it, and how they feel about the food. So it becomes a passive meal time. The children should be active during the meal time, but this is a passive, so they just get food, what happened, they don't care.
So the takeaway message is no electronic gadgets during.
Yes, it's better if you provide them with the crayon or color pencils and blank paper, and they can do something with their hands.
And that also encourages language and interaction rather than being passive.
Yes.
Talk about how the taste of the food is sweet, sour, the colors of the food, what you like, what you dislike. Yeah. Thank you, Victoria. We've got another question from Rizzy. Rizzy says that my kid is 3 years old. For this, also 3, but only eats rice, bread, cheese, some vegetable, egg, chicken. And he needed to be put on into a bread diet and using chocolate rice for a year. And this resulted in some throat infection at that time. So sometimes we might misinterpret a child's misbehavior as food refusal. Would you recommend or advise parents that, once most of the time when kids fall ill, the first thing they do is to stop eating, or you sense that they have a difference in their diet? would you recommend parents to do something at home or bring them to the doctor right away or to monitor them?
I'll suggest to bring to the doctor to first to rule out the medical conditions because we don't know what happened inside the body. What we can see is their refusal of food or their traumatic experience, but we don't know what causing them. Maybe they're gagging because they don't have the ability to swallow and chew, and there's something happening inside their stomach or inside their neck. We don't know. So it's better to bring them to the pediatricians and then ask for referral for a speech pathologist or occupational therapist or something like that to further manage issues found.
Victoria. So I think the takeaway message is don't wait. It's better to check it out and be safe and to rule
Yes,
out any medical conditions.
that's right.
And one more question, Victoria. You mentioned about food intolerance test. Is this available in Indonesia? If parents feel that my child has runny stools, is this something that they can get tested in a hospital?
As far as I know, there is only one laboratory in Jakarta that can do that. So not in hospital, but in one of the laboratory.
Okay, okay, sure. Thank you for that. Is there anything else that you would like to mention, Victoria?
So because we are not finished here today, I would like to invite you guys to join us again. Uh, the time and place will be up for speech pathologists with Dr. Lisa. But we are not finished here. We can continue this later.
So thank you so much, Victoria. Yes. Now we're going to make some important announcements. So rest assured that Victoria will be answering your questions and make sure to follow us on Instagram or Facebook because we will be posting the answers up this coming week. And a recorded version of today's talk will be available this week shortly. We will be holding a feeding talk in late April on facing food refusal, as well as setting a positive environment, as well as strategies to help your child focus during meal times. We'll post details up online soon. Thank you all for participating in today's feeding talk, and a very big thanks to Victoria for her time, expertise, and sharing her knowledge with moms and dads on picky eating. Victoria does online consultations, so do contact her at Leona Victoria _ Aligizi, AHLIGIZI, for problem-free feeding. I'm sure you will feel very supported. And last but not least, I would like to give a very big thanks to our translator who has been faithfully translating Bahasa to English from Vigi Clinic. That's none other than Deanne Rose. Thank you, Deanne. Okay, we've come to the end of our talk. So thank you all very much for attending today's evening talk from 5 to 6 p.m. We hope to see you again and we will post details up online soon. Thank you. Bye.
Every time I think I will sign it because I don't want to print out. Then I have to check through what he has written.